Next question is from Michael Bosurkiv, who is a contributor to CNN. Michael?
Yeah, thank you for taking my question. This is a topic very dear to my heart, immunization, having worked on many campaigns around the world. A question for Madam Executive Director and perhaps Dr. Kate. A big criticism of immunization has been that it's been very siloed. For example, a lot of resources and infrastructure going into polio, and that resources aren't shared. Do you think, given the dire situation you've outlined, that it's time for a total rethink of immunization, that the more synchronized campaigns, more shared resources, that sort of thing? Thank you.
Thank you. Dr. Bryan, or maybe Henrietta, whoever wants to start. Maybe Kate, please.
So thanks for that great question. I think the COVID pandemic is bringing to the surface something that, in fact, we've been focusing on for quite some time, is that the immunization program is the public health program that has the widest reach and the deepest impact, really, of any public health program that we have anywhere around the world. Every country has an immunization program, and it serves all children, as well as adolescents and adults in communities. And because of this is the way that we can also layer on other interventions, and we can link up with other interventions. And in fact, vaccination campaigns are now integrated across not just vaccines, different vaccines being given in campaign mode, but with non-vaccine interventions, deworming, vitamin A, and we're looking for more and more ways that the immunization program can integrate more deeply and can actually be some of the leading edge of growing even further primary health care services. So this is definitely, I think we're all in the field of immunization seeing that there is no going back. There is no pre-COVID world that we're going back to. And we're looking for every opportunity and every innovation for how the immunization program can actually take a leap forward through the pandemic and into an even better program that serves more people, and especially is serving those children who are completely left out of immunization services, the so-called zero-dose children, so that we're actually getting the degree of impact that all countries around the world have signed up to.
Thank you. Maybe our guest would like to add something. Henrietta?
Oh, good. Thank you very much. Yes, so to add to Kate's comments, Michael, you're onto just the right issue, which is how do we use these resources in the field? The polio workers have been trained really well. So part of our puzzle will be how to make sure that we are giving good training to all of our healthcare workers on each one of these diseases and how we approach each one a bit differently in terms of vaccinations and community surveillance and basic hygiene. The other one is one that Tedros and Seth and I have all talked about, but I think has a real chance now. The idea of hygiene has changed in all of our minds in developed countries and developing countries. How often we wash our hands, how we use soap. This is not available everywhere in the world. So if we can focus on getting good systems, wash systems for water and soap around the developing world, it will have a lasting impact, and it will change both what healthcare workers can do, but also how communities can keep themselves safe. Thank you.
Maybe Seth would like to add something to this?
Yes, so finally sorry, I was on mute. I just want to add something to what both of my colleagues have said, and I want to go back to what Kate said about the zero-dose child, and that's a really important concept. We know that with routine immunization, we reach about 90% of children in the world with at least one dose. That last 10% are particularly important because if they're not receiving immunization, they're not receiving anything. And if we want to get to the goal of universal health coverage and to extend the primary healthcare system, those are the critical frontiers. And if we look at that group, 2/3 of them are living below the poverty line. So this is pro-poor, it's pro-women. And the reason I wanted to bring that up is it's a mindset shift, because let's just say you're looking at bed nets for malaria, which is about 45 to 50% of the world that needs them is covered. Let's say you want to add 10 additional percent. You can go to the easy ones and add 10%, which will save lives. But if you go to the place where the zero-dose children are and we join together, those children are more likely to not just get malaria, but if they get it, they're more likely to die because there's no treatment. So if we can bring to these situations a collection of interventions and most importantly, plug them into a primary healthcare system, we then get to our universality, and that's going to be critical also for global health security, because it's those health workers, that system, that is going to be there if outbreaks start in those settings. So this really is part of a mindset shift that has to happen. Over.